Sure, I'm Michael Snyder from Houston, Texas. I'm a colon rectal surgeon there. Been in practice there for 16 years.
I'm Richard Billingham from Seattle, Washington. I've been in practice since 1979 and became interested in colon and rectal surgery, having seen a colorectal surgeon do some work during my residency, and wasn't sure if I wanted to do that, but thought I would take a chance and go take the training and see if I liked it, and I did, and I've been doing it ever since.
I'm Randy Bailey from Houston, Texas, also same place as Dr. Snyder. I've been in practice in Houston now for 38 years.
Dr. Michael Stamos from UC Irvine, California. I've been involved in education for both general surgery residents and more recently colorectal surgery residents for the last 21 years during my time in practice there. I'm currently chairman of surgery at the University of California, Irvine.
But they really want to have a nuts and bolts book about how do they take care of the patient in their office, and having that kind of textbook is really a big need for them to figure out what to do and be able to have points where they can say, well, this is the way that needs to go be looked at, and have a plan of action for them. I think fills a very significant need for them in colon rectal surgery.
When we first started thinking about a book, the people from Elsevier contacted me and said that they were interested in doing a textbook on colorectal surgery, and my reaction was there are already plenty of good colorectal textbooks already. And then we got down to the concept of what the audience might be, and we conceived of this book as being more designed for the general surgeon or the general surgery resident who can take this and digest it a little bit more quickly, smaller chapters and still a fair amount of detail. And the other thing that was appealing to me in starting to think about doing this book was the ability to include a lot of illustrations and color photographs to help explain some of the things that we were trying to talk about.
It's really helped with the information explosion that's occurred in the last decade, really, in our profession, where you have the sharing of techniques. Laparoscopic procedures can be seen on the internet by both physicians and non-physicians. The training and the learning that goes along with that information exchange is really quite profound, and allows a lot of education to occur without having to go to a course or go to some other way of obtaining it. You can obtain it from your home, from your computer, and be able to then give the knowledge to help treat your patients.
The other issues that this brings up are the explosion of knowledge in all of surgery and medicine, and particularly in colon and rectal surgery, and it's very difficult for an individual to keep up with every aspect of every condition, and often we will refer to the internet or our textbooks to get reminded of a comprehensive idea and outline of where we are with a given problem, so we can more effectively treat a patient. And that changes much more dynamically these days, so I think the internet is going to be very important, and an opportunity to have the latest information about this in a digestible, understandable form for those that don't do this as often as others.
I think that at this point in time, having the ability to have a paper book that you can put in your office or at home to look things up on, or to have the ability to do the same thing on your computer or even on your handheld devices is quite important.
I think electronic media is obviously here to stay, and I think that the current e-readers make reading off of a screen much better than it was in the past. I still personally like the feel of a book, but the fact is that the e-readers and the electronic versions allow you to have that document, that reference at the point of care, which is really the critical aspect. nobody's going to carry a textbook around in their pocket when they're taking care of a patient, but they can carry around one e-reader, whether it be a smartphone, whether it be a tablet, whatever, and access all of these different reference materials, including our textbook, at the point of care, that is at the bedside of the patient. And that's really, I think, not just new and unique, but actually, I think, revolutionary in the way we will, transmit knowledge and make sure that we have, complete knowledge at the time of caring for patients.